if you're on Medicare, there are 3 important things to be aware of when you first join in every year after that to make sure you're not making silly Medicare mistakes. So let's cover what these 3 simple things are that make a huge difference when it comes to your Medicare. I'm Emily with the Medicare Coach. I'm an independent Medicare consultant helping our clients easily navigate both the Medicare rules and insurance company options to do what's best and right for you. So let's jump into this one. There are 3 things that I want you to do every single year when it comes to Medicare. And I've had calls these last few days that can take hours, which would have been so much easier had we done it right the first time. So here are the 3 things. Number 1, please do not forget to pay your premiums. Most of you will have a premium for Medicare Part B, as in boy, and then you'll either have a Medigap and a Part D plan, or possibly a Medicare Advantage plan. Now, if you're drawing Social Security, your Medicare Part B premium is taken directly from your Social Security check. So if you're drawing Social Security, you do not have to worry about your Medicare Part B premium. But if you are not drawing Social Security, please pay these premiums. Medicare usually sends you a quarterly bill for your Medicare Part B, as in boy premium. So please look out for those. Now, you either pay that bill in full or do things like enroll in Medicare Easy Pay or even log into your Medicare.gov account to pay these premiums monthly or quarterly. My point is this, please do not forget to pay your Medicare Part B premiums. If you forget to pay them, your coverage can lapse and it can take a while to get your Medicare coverage back. So do not forget to pay your Medicare Part B, as in boy premiums. Now, your Medicare Part D as well as your Medicare Advantage plans, those can also sometimes have a $0 premium or higher than that. My point is this, both of those types of plans, both D as well as Advantage, can also be taken from your Social Security check if you're drawing benefits. So if you're not drawing benefits, you can pay a different way. But please, again, do not forget to pay those premiums. The specific Part D company or Advantage company will help you set up those payments so you can have those paid and, again, avoid getting your plan canceled, which, again, leads to lapse in coverage as well as accruing penalties. Finally, Medigap plans, also called Medicare supplement plans. These plans are not usually taken from your Social Security check. In most cases, the insurance agent who enrolls you in the plan will help you set up the actual payment. So again, you can be billed monthly, annually, you could have the auto payment set up as well, but please do not forget to pay those plans because losing your Medigap plan can be hard, if not impossible, to ever get back in the future. So tip number 1, please pay all of your Medicare premiums and double check it every single year. Tip number 2, please ensure that you are checking the networks of your providers before you go get care from them. Okay, so again, whether it's original Medicare or even Advantage or even durable medical equipment, there's certain approved providers. So in order to have your Medicare work the best, you want to ensure that your provider takes your specific Medicare plan. So doctors, providers can change even mid-year. So before you ever go incur health costs, please triple check that provider does take your Medicare plan so you avoid those big costs later on. I know it seems weird, but they can change periodically, so it's better to be safe than it is to be sorry. Tip number 3, when a doctor sends you the bill, don't just automatically pay it. Many times when you're on Medicare, there is a lag in terms of when Medicare or when your Advantage plan actually pays the doctor. And they can sometimes preemptively send you doctor's bills. If you're on original Medicare, you're going to have a Medicare Part B copay at the beginning of the year, which is very normal. But any other bill you get from your doctors, you should be asking yourself, is this appropriate? Should Medicare pay this? Should my Medicare supplement plan pay this? Or am I responsible for this? Same with Advantage. Please just triple check how the billing is happening and get the billing correct, because they can oftentimes have billing confusion. People can pay them a little bit too early because things are kind of unorganized within the doctor's office. So again, be thorough, be thoughtful, think about the bills as you're getting them, pay the ones you need to pay, but also be aware that there are billing issues when it comes to Medicare. So I hope you found this helpful. Medicare can be confusing, but it can also be really great health insurance. Let us know if you have any other questions down below in the comment section, or like this video for more inside tips when it comes to Medicare.